Strattera, which is also known as Atomoxetine, is a medication that is used for the treatment of attention deficit hyperactivity disorder, the ADHD. Strattera works by selectively inhibiting the reuptake of norepinephrine in the frontal lobe of the brain. And inhibiting the reuptake of norepinephrine means that we have higher levels of norepinephrine in the frontal lobe of the brain while being on Strattera. And Strattera is generally well tolerated by most patients, but it sometimes may lead to side effects that will be mentioned in this video here. And it is very important to know that every person will have a different experience with the side effects of Strattera, meaning some side effects that will be present in some people will not be present in others. So starting with the first Strattera side effect, and that is the increased heart rate and blood pressure. Now, Strattera inhibit norepinephrine reuptake, leading to higher levels of norepinephrine, as we mentioned, and this will lead to sympathetic nervous system activation, and this will lead to activation of the adrenergic receptors in the heart and the blood vessels, leading to elevated heart rate, which is tachycardia, and elevated blood pressure. And this side effect is the reason why most patients who stop the medication do so. Now moving on to the second side effect, and that is mood swings and insomnia. Now, mood swings is sudden changes in how you feel between depression and being very happy. And insomnia is inability to sleep, and that is caused by the higher levels of norepinephrine that comes with Strattera in certain brain regions lead to mood swings and insomnia. Now regarding the third side effect, which is the gastrointestinal tract side effects, and those include the nausea, vomiting, and decreased appetite. And that is because increased norepinephrine levels that comes from Strattera also affects the enteric nervous system. And the enteric nervous system is the neurons that are inside the gastrointestinal tract, so they would get affected by the norepinephrine, leading to nausea, vomiting, and decreased appetite. And the gastrointestinal tract side effects also caused by that the elevated norepinephrine levels may also stimulate the chemoreceptor trigger zone in the brain, leading to nausea and vomiting. Now for the fourth Strattera side effect, and that is the hepatotoxicity, which means liver damage. So Strattera is metabolized in the liver, and in rare cases it may cause damage to the liver. And there might be an immune-mediated component of the Strattera hepatotoxicity. And symptoms of hepatotoxicity include yellow skin and eyes, itching, upper abdominal pain, and dark urine. Regarding the fifth Strattera side effect, and that is the urinary symptoms, so those include difficulty urinating and rarely urinary retention. Now the urinary symptoms is caused by that the elevated norepinephrine affects the alpha adrenergic receptors in the urinary tract, which lead to contraction of the bladder sphincter muscles, causing difficulty in urination and urinary retention. Now let's talk about the sexual side effects of Strattera. So those include decreased libido in males and females, and weak erections and difficulty ejaculating in males. And those are thought to be caused by that the higher norepinephrine levels can affect the alpha adrenergic receptors in the genital region, which can affect the blood flow and nerve signaling there, leading to sexual side effects. Strattera may lead to allergic reactions in rare cases, and those range from mild rashes to severe angioedema. And the final side effect of Strattera is the weight loss, and higher levels of norepinephrine may suppress the appetite centers in the hypothalamus, leading to anorexia and weight loss. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like and subscribe.